Today I'll be talking about the advanced treatment of the heart failure. In the last session, we have talked about how we can diagnose heart failure, what are the common symptoms of the heart failure, and what are the basic medical management of heart failure. But in spite of this optimal medical treatment and the optimal guideline-based treatment, patients often need repeated heart failure-related hospitalization due to increased shortness of breath, due to progression of the disease itself, and sometimes due to decompensation of the hemodynamic status. That means the patient was quite okay a few days ago while he or she was taking medications, but suddenly due to some factors, we call it aggravating factors, or any compromission of any hemodynamic status, patient is needing the medications in an injectable formation and sometimes needing admission in a hospital. Otherwise, patient is having severe shortness of breath and swelling of the legs, and sometimes patient can't even take a rest even in supine posture and not even able to sit properly without any oxygen support. So these are the indications where the patients actually need hospitalization. And after initial stabilization, it is important to reconsider the treatment schedule, the treatment plan, and some of the advanced treatment. So what are the advanced treatment options for heart failure with reduced ejection fraction? So we are all aware of certain devices, implantation. Perhaps the awareness is there, and most of the patients that I see in OPD are quite aware of the certain devices that we always talk about, and through several print media, news media, and other health guide, other certain print publications, these devices. These are very important devices. I'm going to discuss about one of such devices. We call it CRT devices. CRT. It is called cardiac resynchronization therapy. So why this resynchronization? What happens in heart failure is that there is desynchronization between two ventricles, the two chambers, which are very much important to give blood flow to whole body. The left side chamber is the left ventricle, which is normally failing in cases of heart failure. It has a low ejection fraction. That is one of the measurement of how the left ventricle is contracting, how the left ventricle is performing. And another is right ventricle, the right sided chamber, which helps to flow blood to the lungs. So in any of the failing situations, when the ventricles are not able to pump out enough of blood, this kind of dyspnea, the shortness of breath happens. So when the left ventricle fails to pump enough of the blood, the normal symptoms of heart failure, as I have talked about in the last session, the symptoms of heart failure happens. So what CRT does actually is that CRT tries to pump out more blood from the left ventricle. It increases the left ventricular contractility, which normally fails with medications. So CRT devices is a different kind of devices. It is not a normal pacemaker that we are quite aware of. It requires 3 lead implantation, one in the right atrium, that is the right side chamber, one in the right ventricle, again the right side chamber, and one is the left ventricle. So left ventricle lead implantation is quite challenging. It needs expertise and technological sound knowledge, because we implant not directly in the left ventricle. We implant the lead to call a channel that is called coronary sinus, and through which we implant the left ventricular lead, and from where the lead give impulses and the left ventricle contracts, and so the normal physiological mechanism which was deranged in heart failure patients, it gets normalized. However, it should be remembered that it is not always possible to implant these kind of devices. There are certain anatomic abnormalities in the coronary sinuses. Sometimes it is so narrow that you cannot pass the lead. Sometimes there may be dissection. Sometimes the anatomical position of the coronary sinus is as such that even after successful implantation, the exact the outcome is not enough. We call it non-responders. That is, even after successful CRT implantation, the patient is not getting enough contraction enhancement in the left ventricle that they should ideally. So this is called a non-responder, but otherwise the responders are quite good. They normally have a very good improvement in the left ventricle performance, and here lies the beauty of CRT devices. CRT again can be combined with an ICD that we call a CRT-D. We will talk about ICD in later session. ICD is a kind of pacemaker which prevents sudden cardiac death. So if we can combine the CRT and ICD, we call a CRT-D, that is your right ventricular lead is basically an ICD lead. So in that setting, the patients are getting dual benefit. On one hand, the left ventricle performance is increasing, and on the other hand, if the patient has any arrhythmic episodes for which patients may succumb to fatal accidents like death, can be prevented. So these CRT devices, CRT-P, that is a normal pacemaker mode, and CRT-D, that is with the ICD pacemaker, is one of the advancement in the heart failure that any patient with heart failure with reduced ejection fraction with a particular criteria who are meeting the particular needs for this CRT should go for it. Well, in some of the heart failure patients who are really very unfortunate in some of the criterias, like if the QRS normal duration is not very wide, then they are not a suitable candidate for CRT device implantation. In fact, the implanting the devices ultimately gives a hazardous outcome, because on one hand they are not getting enough benefit, on the one hand there is a risk of infections of the devices. As a whole, you have to bear a lot of consequences. So before implanting CRT devices, we need to monitor the patients, and we need to check certain important criteria. The criteria has been laid down by the international guidelines, and by properly following the guideline based criteria and implanting in a proper way can give a significant improvement in a patients who are having heart failure symptoms with reduced ejection fraction. So this is where I would like to end today's short discussion. This is regarding the awareness of CRT. So the patients who are suffering from heart failure symptoms, taking optimal medications, still their left ventricular performance is very low, and they should be considered for CRT devices provided the criteria that has been laid down for CRTs are met in those patients. And you should not be at fear of implanting devices, rather you should be enthusiastic regarding the implantation of CRT devices, because this can give a significant improvement in your heart failure symptoms as well as can prevent sudden cardiac death. So thank you very much for listening. Keep subscribing in my channel. I would like to come back with another sessions of ICD pacemaker in my next session. Thank you.